morning, good afternoon, good evening. Welcome to the IFA Global Café. My name is Katrina Brazanis, Director of Policy and Advocacy here at the IFA. And so as the population rapidly ages and as people live longer and work later in life, the value of age diversity in the workforce becomes clearer, yet ageism remains widespread, often in the form of stereotypes about older workers, limited opportunities and reduced training for older people, and lack of recognition of their value. And for today's Global Cafe, we will be speaking about ageism in the workplace and creating age-friendly work environments. And so joining us today as our expert, we have Dr. Tazim Virani. Dr. Virani is a seasoned registered nurse with a PhD in health policy, management, and evaluation. She earned her Bachelor of Science in Nursing from University of Toronto and her Master of Science in Nursing from Western University and her doctoral degree from the Faculty of Medicine at University of Toronto. With over 40 years of experience in health and social development sectors, Dr. Virani has excelled in diverse roles, including as a clinician, an administrator, an educator, a researcher, and a system leader. And currently, Dr. Virani serves as the Senior Vice President of Social Impact and Global Initiatives at SC Health, where she leads the Future of Aging program. And so this initiative, which we'll speak at large about today, is dedicated to enhancing the dignity, choice, and independence of older adults within their homes and communities. And so through Dr. Virani's role, she also plays a pivotal role in the Canadian Coalition Against Ageism and the UN Open-Ended Working Group on Aging. So thank you, Dr. Virani, for joining us today, and super happy to have you speaking about this topic.
Thank you. Lovely to be here.
So we always at Global Cafe like to start at the beginning and learn a little bit more about you before we fully dive into the topic. So I'm wondering if you can tell us about your story and how did you become involved in the field of aging and ultimately in your role at SC Health?
Yeah, so, when you've been around working for over 40 years, I have to say I feel really blessed in my nursing career. I always laugh and say that as a nurse, you have so many choices in where you end up in your career, and I feel very blessed that I've had those. But yeah, so I've largely, I've trained in, trained in Canada, worked largely in Ontario. But as my career evolved, and I took on other roles as a educator, researcher, consultant. I had a consulting business for about 17 years. I really got involved in the whole policy arena, and my research background, policy background, et cetera, really helped. And I think also, and very much so, my clinical background. And so for a good part of my career, I was very much involved in evidence-based practices, particularly in the context of aging. I established a program called the Nursing Best Practice Guidelines Program, and it's now a legacy program that's been going on over 25 years. And I would say that was sort of my first foray into really kind of concentrated focus on from a clinical lens, things like falls prevention, things like dementia, depression, delirium in the aging population, continence management, all of those kinds of things that are very much part of, I would say, both physical and mental health. But as my career progressed, it became very much more around policies and how older adults and how aging in our society either is supported or not supported by policies and what we needed to do. So this has led me, all of these different career paths led me to come to work at SC Health, which I'll explain in a minute, the organization a little bit, which will give you a sense of how I ended up doing what I'm doing. But it's really within this last 8 years that I've been at SE Health that my focus on looking at aging in a much more comprehensive way beyond those clinical needs, looking at issues that are barriers to having, to live a good life right throughout your life, became very consolidated. So issues of ageism became really foundational to those areas of focus, but also things like how we live, where we live, with whom we live. So age-friendly, affordable housing, creating communities that are age-friendly was another part of the kind of direction that the work that I started to kind of get involved in. But I want to just speak a little bit about the organization that I'm in. So at the core of it, St. Elizabeth Healthcare, SE stands for St. Elizabeth, is a organization that's been around since 1908. It's a not-for-profit charitable organization. And while its core is providing healthcare services, as a social impact organization, right from its early roots, it's always had a mandate, a mission to look into society's needs and where there are gaps and try to address them. So in 1908, the big issue at that time was women and newborns. And so our founders, who were these 4 nuns who were nurses, they were the ones who started providing care and services to mothers and newborns. But as the years have gone by, we've continued to address other issues. In the 70s, it was HIV, AIDS, that was kind of the big gap in society. End-of-life palliative care was another one later on. And over the last sort of 15, 20 years, the longevity and the challenges, both in terms of services, but also in the broader context of aging, has been a focus that we undertook. And so that's how I ended up at SE Health in terms of really addressing this gap, and knowing that this is not something you do on your own. You do it with others. So we have this really, foundational work that we started some years back that we call Courage, Action for Better Aging. And it's really about changing the narrative in aging in Canada, and looking at some of the collective ways that we can try and do that.
Mm-hmm. Thank you, Dr. Virani. That was such a great overview of SE Health, and also very interesting to hear a little bit of kind of the background of that organization and how the organization has come to work on some of these issues. So I think that's a great lead in into speaking about the Future of Aging program. So I'm wondering if you can tell us a little bit about what does that program do and how did it come about?
Yeah, so as an organization that's been around over 115 years, our focus is really working in the community. So we provide home and community care services largely, but there are other components and other divisions in our work. Like we have a research institute, we have a health career college. We do work across Canada, but primarily in 4 provinces. And we have 8,000 staff. And so as an organization, we have this this value that no margin, no mission. And so through our work that we do, and we largely get government contracts, et cetera, the reserves or the margins, if you will, from those programs help to support our social impact initiatives. So as a start, just so you know, our majority, I would say, 90% of what work we do in our Future of Aging program is funded from within the organization. So I just wanted to state that. But as the program, it's really about a broad mission of building a better world for all of us, because all of us, if we're lucky, are going to live to a long and healthy and happy life. But we do see challenges, and as an organization, we see them daily because a large percentage of the individuals or families that we care for in the community are, our aging population, our older adults. And so we have this kind of direct view on where people live, the housing challenges people have, the kinds of access to healthcare services or social care services that they may or may not receive. And so this program really kind of got established. And so we are a small team, but we have this kind of large organization that kind of backs us up both financially and in other ways. And our approach really is in multiple folds. So, as I mentioned before, we leverage this notion of collective impact. And that means we know that to make large changes or to change the narrative, we must work with others. So a lot of it is about establishing coalitions. So Courage Action for Better Aging is a coalition that of like-minded or diverse individuals and organizations that come together to try and solve issues. And I can speak a little bit more about it later in terms of some of the specific projects that group is doing. But as a start, we felt that combating ageism, because it is so prevalent, and I don't need to say this to this group, you've had sessions on this in the past, is such a core issue that we needed to address that. And so we started out by really educating ourselves. We have a large number of staff, but also working with others, so GARUP, the Global Alliance, working with others in the Canadian ecosystem, ILC, IFA, National Institute of Aging, and really creating this coalition that we are referring to as the Canadian Coalition Against Ageism, and we were one of the founding members, but really starting with that ageism focus. The second sort of, I would say, lens that we took was around innovation. And we took a few different elements of innovation and projects that we started to focus on. So really using, again, collective impact, co-design, but an innovation lens to a few things. For example, affordable housing models was one that we really focused on. And we have a website, which we can put a link later on. It's called Building with Mission. And it was really around this issue that we have a trajectory in Canada where as you get older and your needs change, you have few options, and the few options lead you ultimately into living in segregated communities like nursing homes, retirement communities, and so forth. And we felt that shouldn't be the only option or the only few options that one has. So looking at different ways of providing housing models that are that allow people to live in the community close to their homes or really age in place. And so that became kind of a big focus of our work. And then within that, looking at more comprehensive models, we have a very fragmented system of getting supports and services. So really trying to do more thought leadership, advocacy, but also practical initiatives to try and what we call 360 models of living.
Mm-hmm.
And within that, everything from how services and programs are kind of coordinated and collated, but also the needs of families and formal caregivers. Don't know if you wanted to pick any one of those to dive into, but really that's the vision. The vision is really around trying to address some of these key challenges within, and those initiatives change over time. So, at one time we were really focused on one thing, and then over time we focus on other things. So right now, for example, housing is really critical. The needs of caregivers is really critical. But we have taken this pivot towards aging in the workplace. And primarily because we as an organization have a large number of staff that are, we have a healthcare crisis in terms of health human resources. We want to, ensure that we are walking the talk in terms of, the issues of ageism, but also large numbers of people are continuing to work, and how do we ensure that the workplace is also addressing the needs of an aging worker.
Mm-hmm. Yeah, thanks, Dr. Virani. I think that was a really great comprehensive overview of the entirety of the program. But as you said, it would be great to dive into a little bit more of that combating ageism pillar, and specifically, obviously, the focus of today's session. We could do a session on each of these pillars, but the focus of today's session, which is really around kind of ageism in the workplace. So I'm wondering if you could just break down a little bit, what is the issue here, and what kind of strategies is the program putting in place to combat ageism in the workplace?
Yeah, no, I would love to do that. So again, it's not going to be news to anyone that as you age, our society is structured in ways where ageism is so infiltrated in so many different ways. And I mean, on a daily basis, I talk to individuals who are in their late 50s, 60s, and 70s that are trying to either pivot in their workplaces or have left or have been pushed out of workplaces. They're trying to find work and getting into a work situation, particularly as an employee. They face tremendous amounts of stereotypes and challenges, and that is one of sort of the very practical kinds of things that we hear and see, and so everything from how things are set up, from posts that go out for recruitment, how job descriptions are written, the individuals who are doing the hiring processes, the kinds of things that are sometimes quite inherent and people are not even necessarily thinking about this. And so some of the kinds of things that we hear about are, being told that you're outdated, or older people are less adaptable or less tech savvy, and all of this kind of impacts hiring processes. When individuals are within an organization and they're working, there are many different things. You sort of in your introduction mentioned a few of them, like career opportunities, for example, or training opportunities, or things that are succession planning programs that are established, and older individuals are left out of it because they're thought of as individuals that are going to be leaving the organization. So why spend the time, and energy on it. But there are also some other like very practical things. So if you look at our benefits packages, right? So one of the ones that was brought to my attention recently from one of our own staff who was, coming at a point where she had decided that she was going to retire. And she brought a couple of things to my attention. One was, she said, did you know that as you age, we have these needs to have, hearing examined, hearing aids. And, none of us think about the fact that our benefits have, our eyeglasses, at any age that are, we have benefit package to cover the cost of our eyeglasses. But for hearing aids, it's very little. It's like $300 or something. And the cost of a hearing aid can be in the thousands. And so, older workers, just in terms, like that's a very sort of, precise example of how our benefits packages are also ageist. We don't think about the needs as individuals age. So that's one practical kinds of things. The other one was almost every insurer in Canada, at least, but this might be around the world, is that your long-term disability benefits cut off at 64.5 years. So even if you decided you wanted to retire, and there's in Canada, no mandatory retirement age, but there is this practice of 65. Nowadays, of course, people are working a lot longer than 65, sometimes out of need, sometimes out of choice, and sometimes out of invitation, by organizations. But by and large, not the latter. So hearing aid is one. So the other one is, as you age, you also have responsibilities of caregiving that is not supported. So at a younger age, in Canada, we're blessed to have, good benefits in terms of maternity leaves, parental leaves, etc. But as you age and you're looking after your spouse, your parent, caregiving benefits are practically non-exist. So they are these, again, things that are either haven't caught up or are purposefully not provided, and they're cues for you to exit out of the workplace. This is now becoming more and more an attention. And so as workplaces realize there is a labor shortage, particularly in certain types of industries and skill sets, these things are now coming up to the surface in terms of keeping older workers.
Yeah, thanks, Dr. Virani, for kind of outlining that challenge and all of the components that kind of go into this. So I'm wondering if you can speak a little bit about, what are the strategies that can be used to combat some of these different components that you're talking about? And perhaps that's, a focus on what SC Health is doing or what others are doing.
Yeah. So one of the things that we heard, and our starting point is always to listen, right? So listen, see what people are talking about, what are they, and I wouldn't say we have addressed everything. This is a massive challenge, but we have started to, and there's been a huge amount of commitment within the organization. And I would say that's the starting point. The starting point is really getting the board and the senior leadership to really understand the issues and give you endorsement to start to work with other departments to address that. And I would say it was all of the early work that we did on educating within, externally, and really being a leader in addressing ageism broadly in society, that when it came to looking at very concrete things and policies within the organization, people got it and they understood. So that I think early groundwork was really important.
And sorry, Dr. Virani, to jump in, but maybe just I'm curious to dive maybe just a little bit deeper into that, because for people that are maybe looking to do this in their own kind of workplaces, Do you have any tips on how to have those types of conversations and how to have that kind of knowledge generation internally and externally with the
Yeah.
different stakeholders that people work with?
So it isn't one thing, it's many things. One of the things we did was we knew that our small team alone wasn't going to be able to shake all the trees. And so we developed a alliance, and it's called the Age Positive Alliance, and it's largely a group of, I would say, champions. And so we started as we uh, you know, did presentations and discussions. We invited people to join this Age Positive Alliance, and so right off the bat, there was this kind of burgeoning growing group of individuals within the organization, but we didn't limit it to that. We sort of said, anyone, even our alumni, people who had left the organization, anyone who could participate. But the idea was to have more than one voice or more than 4 or 5 voices. And that started the conversations. It was a lot of different conversations and really looking at what are the pain points for individuals. We have an organization that has a lot of sort of underlying ethos towards, we call this kind of people everything approach. And so in that way, it wasn't too difficult, but it still required many, many different conversations. And we interjected it in fun ways. We did, for example, on an annual basis, we do a company picnic, and we would have like booths and, things with, fun ways to try and get people to really live and understand this. We would circulate little, short newsletters to our alliance, but we would copy our senior leadership and our board. And there were times we held like webinars with experts coming from external. But I think what really helped was also getting engaged externally. And when you get engaged externally, for example, in the UN Open-Ended Working Group and, talking to other organizations, the signals came back within the organization and said, hey, our people are being heard and are discussing things externally, we better be actually implementing some of these things. So that actually kind of self-imposed pressure was really important. But some of the practical examples I'll mention in a minute are also very much the imperative of the day. So as far as, aging and ageism and workplace, there is a practical imperative. We actually need to keep, we want to attract staff, we want to keep staff. And so some of the more practical things we've done is a flexible work environment and a flexible work policy that includes, for example, our nurses, our personal support workers, our physios, OTs, but also our management, back office staff, et cetera, have the option to work in a flexible work environment, hours of day, but also, part-time, full-time job sharing. And that kind of autonomy helps people manage their lives. And not everybody can work in a very strict 9 to 5 kind of environment or 8 to 4 or whatever. So having the workplace policy that's really flexible and supportive, it has been really, really a tangible benefit. Another one, people, as you progress and increase your responsibilities and accountabilities in the organization, have found that it becomes tiring, and people often leave an organization because they either want to do other things, they want to explore other opportunities, personal things like travel and so forth. And so we've established sabbaticals where people can, take paid sabbaticals, up to a year. where they can go and do other things. That's a more recent thing that we have established. And in healthcare organizations, that is kind of not a common thing. But we're evaluating how that goes. And then one that I'm really, really proud of, we're just starting this and work is underway, is, I mentioned about the caregiver stresses. So in our organization, that's what we do. We do caregiving, but our own staff are also caregivers of their own family members. And so they have this kind of double duty, we call it the double duty caregiving responsibility. And that's very stressful. It's draining, and they need supports. And the broader public system has limited respite available. So in our benefits package, we're working right now with our insurer to co-design a benefits package that includes caregiver respite, where the individual can take X number of days over the year to go and a paid respite to address their family caregiving needs, similar to how you would do like parental leave and so forth, but it's a little bit limited due to the cost of this. But it's a start of really paying attention to that type of issue, so that we are not biasing our older workers who have to take time off, and then inevitably they lose their job, or they take time off, or they just leave the organization because they don't know what else to do. So those are just some practical examples.
Mm-hmm. Yeah, thanks, Dr. Virani. I'm going to go to the chat. There's a question from Shmuel, who is one of our weekly contributors at the Global Cafe. And they're asking, what, according to you, is the role of the legal system and authorities in combating ageism in workplaces?
I don't understand. Say that question again. What?
Yes. So what is the role of the legal system and, more public authorities in combating ageism in the workplace?
Yeah. I honestly, I'm not going to be the expert on the legal framework around this in the workplace. It is, as I mentioned earlier, from a human rights perspective, we are protected in the sense of, you can have a legal challenge if you are let go because of your age. Trying to prove that is often very challenging. So one of the metric that organizations that are serious about addressing this is, do you have age bias legal claims? And we track that, and luckily we haven't had any, but it's also something people have not really caught on to, right? Like they don't know that they can even make a legal claim around this. But our human rights framework and code do protect. And the other thing I mentioned, in Canada, we do not have mandatory retirement, but a practice around 65, but you cannot legally dismiss anyone because of their age. That's really the basis of how I've personally been understanding this issue, but there may be more nuances around the legal work that I'm not aware of.
Yeah, thank you so much. So, I want to go back to maybe some of the solutions that you were talking about. And, as Health has become, I think, a certified age-friendly workplace is, I think, the terminology. So I'm wondering, can you just describe what does that mean to be a certified age-friendly workplace? And also, how do others become certified in this?
Yeah, and this is kind of interesting, and just a little backstory of how we even came to be aware of this certification. So every year we do an innovation challenge. It's called Chrysalis Innovation Challenge, and we pick different themes and invite both sponsors to sponsor prizes, but also startups or community groups or individuals to pitch an innovation and their prizes and so forth. So this one year, we had this group called Age Proactively that applied for this innovation challenge. And their innovation challenge was to bring this certification that started in the US at the Institute of Aging in Minnesota. And basically, it has a set of standards, and I can share a few of those standards. And to be recognized as an organization that's serious about being an age-friendly employer, you would apply those standards, and you would then get formally assessed. You do a self-assessment, you get formally assessed by the Institute, and based on your scores, you get certified, or you're supported to develop an approach to eventually get certified. And so this organization, and we do have independent judges for this innovation. So they won one of the prizes, and we became aware of this program and felt that we wanted to actually implement. So we partnered with Age Proactively and the Institute of Aging to then apply those standards. So for over a year, we kind of really examined the standards. Went around the organization. A lot of it was within our human resources department, as well as our diversity, equity, inclusion, anti-oppression council. And a decision was made that we wanted to actually get assessed. And we are now the first healthcare organization in Canada that has been certified as an age-friendly employer. That doesn't mean you have met every standard, but all the minimum thresholds for every standard, and that you have a work plan that is going to continue to evolve to then get to the higher order of those standards. And every 2 years, you commit to getting reassessed. What this has done for us is really given a very strong signal within as well as externally that we are an age-friendly employer. And so that has meant that we've had to examine all our recruitment policies, our even including things like how we say certain things in our job postings. And people have brought things to our attention and said, well, this seems a little bit ageist, even things like, oh, this position is a entry-level position. Often, talking about an entry-level position sometimes gives the impression to people that older individuals are kind of shut out. So are there other ways to say the same thing that is more inclusive? But DEIA, or diversity, equity, inclusion, anti-oppression, now includes age inclusivity within that, and one of the working groups really addresses this on an ongoing basis. So to be an age, to get certified, it's really, you put in an application. There is a fee for this, but it's a modest fee. And you start applying those standards like you would for, other types of accreditation. And you do need to make a long-term commitment towards being an age-inclusive organization, and so forth. So, there is, for example, one of the standards really talks about the general commitment and workplace policies. So we do have an explicit statement on workforce diversity. We track our age bias legal claims. We track the number of staff over the age of 50. We do, as I mentioned before, review our age inclusive benefits and programs. Our workforce planning has to, strategically look at a balanced multi-generational workforce. We look at various ways of retention of older workers, including the kinds of supports that are provided when people do want to retire, either phased retirement programs or programs that are going to support people beyond their tenure in the organization. Training and development is particularly a key area of focus to ensure that we're age inclusive. And so when people are offered or training is available, it's we ensure that it is clear it's offered to everyone and not and offered in ways that is feasible. Sometimes training is offered when it's not feasible. If you're offering it certain times of the day or whatever, that it may not always work for people.
Mm-hmm. Yeah, thanks, Dr. Virani. So, and then too, as well, Cal has just put in the chat, if it's possible to share that program, so we can certainly connect to that as well, and either put it in the chat or share with our resources.
Yes, I will most definitely do. And I actually would like whoever's, anyone within Canada, I would like to offer them to talk to Age Proactively, because they're the sort of Canadian link into that Institute of Aging. But I'll also share the Institute of Aging website so you can see who else. You can see that, like in the US, this has proliferated quite a bit since 2002. One of the largest ones that I just learned about is Humana, which is an insurer, and they have 70,000 employees, and they've been an age-friendly certified employer since 2012, I believe.
Mm-hmm, mm-hmm. Yeah, so we'll certainly share that, and I think it's certainly a useful tool. Actually, Luana has just shared it in the chat, so that's great. So I mean, I guess Dr. Virani, going from there, I mean, I'm curious to kind of just ask what you've noticed kind of anecdotally since implementing this certification. I mean, have you received kind of feedback from those that work at SC Health, and what kind of impact it's had, in terms of, having older workers and appreciating the diversity of older workers within the workplace?
So I would say that initially there was a lot of kind of like, this is, fluffy stuff, when we're talking about ageism, and like people got it and they understood and they got engaged. But it was not until we got into the kind of hard bread and butter issues, practical things that impacted their lives, like the caregiver benefits, the flexible work environment. That's when I would say the penny dropped, and people really understood, okay, this is what you were talking about, around ageism and how it impacts and so forth. And certainly people who were coming, to retirement age, and we always do this kind of, again, I'm saying retirement age as in the practice of 65, but not mandatory. They were the ones who were kind of saying, like, yeah, and by the way, did you know about this, long-term care benefit that stops at 64, and a half years, and what if I got sick at this last, 6 months of my tenure, my benefits get, but what if I wanted to work beyond 65? How does my long-term care benefit work, right? So it's now opened a kind of more practical questions coming forward. And it's for us to then look at where we can focus on. And of course, we can't focus on everything all at the same time, but we're taking kind of one thing, one major theme at a time and doing it. It was just earlier this week, I was in Vancouver, and we had partnered with the United Way of British Columbia. And actually, this was exactly the topic of conversation there. It was aging in the workplace, and we had a panel. So this was a live networking event, a small group, but amazing conversation that happened. And there were some other interesting things that I learned there that we're not doing. One of them that I hadn't even heard about this terminology was called job philanthropy. So job philanthropy is really often geared towards corporate organizations where individuals in senior level positions in their last year of work, whatever they've defined as their last year of work, the organization donates their salary and that individual to work in a not-for-profit to take those skill sets and supports as part of their social impact responsibilities to support a cause, a not-for-profit cause, et cetera. And apparently this it has started to kind of take on as part of both individuals wanting a sense of purpose and meaning in there and take their skill sets and support a not-for-profit organization. So that came up. The other one that there was a lot of conversation was career transitions at an older age, and how do you support it, and then the intergenerational workplace. The intergenerational workplace, the conversation was really interesting. It's not about new programs and new resources and so forth, but it's really changing the approach to the work as opposed to and that was kind of interesting for me to take away back to my organization. There were some great. I put some of the summary points on a social media post, and I can send that link as well.
Yeah, I think some of those different innovations are really interesting to see how people are really kind of thinking outside the box around this issue and what they can be doing. So that's certainly great, and we can always try to include some of those things as well in our resources as well. So I want to just kind of, as maybe a more final question, I want to maybe kind of take it out a little bit more at a macro level, because you also work with, Canadian Coalition Against Ageism and, some of the different more kind of national agendas or even global agendas at the UN level. So I'm wondering, how, if you can maybe share kind of just an update on what you're seeing in that work and what's going on, and how these kind of efforts work towards the goals that you have at the national level and at the global level.
Yeah, it's a really good question. It's a really big question. So I would say that one of the things that for me has been really interesting is that, when you're in an organization that you see kind of the issues on a day-to-day basis, but you're also trying to look at things in a much broader way, is that sometimes it feels like there's quite a disconnect, right? So, a lot of the big policy issues around, like, at the UN level, it's really about, rights, protecting the rights of older adults. It's at a level that sometimes folks in the organization don't quite relate to and understand or have meaning attached to it. And so it was really important for me personally to try and make what I was trying to advocate for, make submissions on, have conversations with, to really bring some practical experiments or things that we were trying on the ground, but also having people, kind of really relate to these things in a practical way, and not just, I shouldn't say not just, it's a big thing to try and move the agenda on rights, right? But it is often challenging to make it real for people. And so trying to do at both ends for me was kind of a big eye-opener, that, okay, now I can really relate, have people relate in our organization to what we were trying to do broadly, but also now take these examples like today and be able to share and say, well, this is how we're trying to protect rights.
Yeah, and maybe just a final question from Brendan. Brendan, did you want to unmute and share your question?
Yeah, is there such a thing as an ageism database, so that people know exactly what has been talked about when we were talking about ageism?
Ageism
And the issues.
I mean, there's literature databases, right? So one might go into the literature, I guess, and we have done that. They are organizations that have compiled initiatives and so forth that we can, particularly in the intergenerational environment, where we've been looking at, like, what are the different intergenerational programs and so forth. But I have not come across something that just says, like, it's a database for ageism, but maybe somebody else has. I don't know.
Yeah, I mean, I welcome kind of anyone to share in the chat or come back to us with any kind of resources or things like that they may have heard. And I think Jenna has actually put a resource into the chat as well. So thank you for that, Jenna. So we are just kind of coming towards the end of the hour here. So Dr. Virani, I want to give you the opportunity to compile a few takeaway messages from our conversation today. But first, I'll just take a moment to introduce next week's session. So next week, we will have Dr. David Kahn, who is a professor in the Department of Psychiatry at University of Toronto and also a psychiatrist at Baycrest. And he will be speaking about social isolation and loneliness among older people. So a very pressing topic, and certainly one that we're interested to learn more about. So I hope that you all will join us for next week's session. And then Dr. Virani, I'll hand the floor back to you to just share some kind of key takeaway messages from our conversation today.
Yeah, so I think I'd leave like sort of three messages. And so I think, first of all, there is an imperative in the workplace for age inclusion. This is absolutely essential. In Canada, we're living longer. The gap between sort of traditional time when people are leaving work and there's still like a 25-year opportunity for people to continue contributing in the workplace in some fashion, not necessarily always on a full-time basis and not always in the same way that they've always done. So and then there is this major, demographic shift, and the labor shortages are just going to get increasingly more challenging. So creating an age-friendly workplace isn't, for me, just a nice to have kind of critical strategy, but it is imperative. And for me, really having partners in the human resources area, like our human resource chief officer is like gung-ho. In fact, we got an award for some of our work, and it was him that went to receive the award, on behalf of the organization. So our work it's really important, but it is also about age inclusion at all ages, and so that really paying attention to how to create intergenerational harmony within our workplace is something we've also started to do. And so age inclusivity is really important. The other, which I mentioned earlier, is this commitment to a longer process. And it's a continuous improvement process. This isn't a one-time done that, been there and move on. It is really continuing to foster this kind of culture. And so ongoing assessment, policy refinement, and so being part of this CAFE or certification of age-friendly employer, the short form is called CAFE, is really important, that it is something you're going to commit to. There's a framework, there's a structure, and you're going to pay attention to that. And then the last thing really is what I've been saying is that they have to be practical steps. We can't just talk about it. They have to be practical steps. And for us, the workplace was something really a good starting point.
Mm-hmm. Yeah, and maybe Dr. Virani, just one more follow-up. I'm wondering, do you have kind of any final just recommendations to those that are on the call that are kind of hoping that to see some of these things implemented, but maybe not in the position to actually kind of implement? Do you have any kind of advocacy, tools or anything like that that could, just help people on the call that are hoping that to see more employers kind of implement, this kind of age-friendly certification or at least some of the tools from that certification?
Yeah. So honestly, I would say contact us. This is not just about us. We have made a commitment to support others. That's why we, co-hosted an event earlier this week in Vancouver. We've partnered with Age Proactively to support them to make their tools available to others. So that would be just a very practical thing. So just share, you share my contact information. I'm happy to support in that fashion. And I think, reviewing those standards is a really good starting point, because they are, and I would say pick one or two things. And not feel like you have to try and do everything. And so, we picked benefits package as one and recruitment as another. And then I would say if organizations do have a diversity, equity, inclusion council, committee, or program, integrating that within that approach makes, there's a lot of attention, certainly in Canada, on DEI. We've added anti-oppression, so DEIA. Integrating age inclusivity within that allows it to live beyond an individual who's passionate and wants to push an agenda. This now becomes part and parcel of what the organization, commits to.
Mm-hmm. Well, thank you so much, Dr. Virani. That was certainly a wealth of information and a lot of great resources that people can hopefully access. And I'll encourage everyone as well to take a look in the chat for different resources and different information that others have shared on ageism in the chat as well. So thank you so much, Dr. Virani, for joining us on today's Global Cafe. And thank you so much to all the team at IFA that helps to put this on every week, particularly Luana Calnago. And thank you to all of our attendees every single week. And we hope to see you at the next Global Cafe. Have a great weekend.
Thank you.